It has one of the highest COVID positivity rates in New York City, but the mostly Black and Latino Highbridge section of the Bronx is just getting its coronavirus vaccine program going nearly 2 months into vaccine distribution. NBC News correspondent Ron Allen joining me now from the Bronx. Ron, this neighborhood did a lot of prep for the vaccine, setting up cubicles, getting medical equipment and supplies. So how is the rollout going there?
Well, this is a pop-up center. It's a very small community center here behind me that's part of the community here. And it's part of an effort by the state to try to take vaccine to the hardest hit communities and to essentially meet people where they are. You know, we've seen over the past couple of weeks and months that the statistics show that nearly half the vaccinations in New York City are going to white residents, although they're not half the population. And if you look at the numbers for the Latino and Black communities, their numbers, the amount of doses they're getting are much lower than their percentage of the population. So this is an effort to try and correct that, to try and, again, take the vaccines to where people are, because there's been some indications that people are having difficulty getting to where the sites are. One big problem is technology, the internet, online access. People are confused by it. People in some minority communities and underserved and low-income communities aren't as technology savvy. And that seems to be the best way to get an appointment these days. So a lot of people just aren't able to do that. There's transportation issues. There's all kinds of issues. But the bottom line is that there's less health care in these communities all the time. And so there's less vaccine here now as well. Allison?
Ron, you touched on some of the issues that community is dealing with. More than 32% of folks there live below the poverty line. Tell us more about the struggle getting people there vaccinated.
Well, it's these inequities, these disparities. It's basically the fact that there are fewer hospitals and clinics and doctors and healthcare in these communities all the time, year round. And so now, as the country, the state are trying to put together this infrastructure to distribute vaccine, there's not as much to work with, just as there was not as much testing going on here, and there isn't as much treatment going on here. In this neighborhood that I'm in now, it has one of the highest positivity and death rates anywhere in the city, and that probably translates to anywhere in the country. Remember, this was the epicenter of the pandemic many months ago. So we spoke to a member of a task force of community activists named Jennifer Jones Austin, who is, the task force is trying to solve these inequities. Here's how she sees the problem in 2 different phases. Take a listen.
A part of that is because they are hesitant. They're not showing up to take the vaccine. But the other part of it is that those who do want to take it, they're experiencing challenges in actually getting access to it. And we know that in Black and brown communities, and particularly Black and brown communities where people in great numbers are lower income, may not have access to the internet, they're slow to learn about where to get the vaccine. And we see that there are also issues with respect to convenience of ease, access, like literally people sometimes having to drive several miles to get it.
So the bottom line is that the vaccines are not accessible in places where a lot of minority, people of color, low-income families live. And again, this is an effort to try and get it there. Here, they've only been open for 3 days. Each day they've had less than 200 doses, and they've had to shut down when they ran out of doses. And how much longer they're going to be able to continue this effort here and at other places around the city depends on the supply. And we've heard the problems with supply. So now there's talk of supplies increasing. There's talk of more outreach in these communities. So hopefully these pop-up sites here and in churches, community centers throughout the city, hopefully they'll have enough supply to vaccinate people who arguably need this vaccine the most. Allison?
Ron, more than 60% of Americans who have gotten at least 1 dose of the vaccine during the first month of distribution are white, according to the CDC. We're showing the breakdown there on the screen. How are they working to close that gap, not just where you are, but in vulnerable neighborhoods across the country?
It's an uphill battle. It's difficult. You know, you talk to people here who do get an appointment, and they say it's been a struggle. We met one couple who said that they have been trying to get an appointment anywhere in the city for many weeks. They really couldn't deal with being online because they're not very computer savvy. They called and they couldn't get an answer. They feel like there's not enough information out there. Here's some of what they said to us about the struggle that they've gone through to try and get an appointment. Take a listen.
We didn't know where. We had no information. Where to call or who to ask for, nothing.
Yeah.
Nobody told us nothing. That we have no place.
To everybody in the neighborhood, they saving it for their families and stuff like that.
So you don't think that's fair?
No,
it's not
of course
fair.
not.
It's not fair.
A lot of people think it's not fair. You know, there's been so much talk about equity and fairness in the distribution process, but the bottom line problem beyond the structural issues is that there's scarcity. And in times of scarcity, it's always more difficult to be generous, unfortunately. And so people in these neighborhoods are suffering. Again, the death rates are high here. The positivity rate for COVID is still high here. And if the country, the city, the state are going to turn this pandemic around, you have to get vaccination rates up to 70, 80%, people are saying, to get that herd immunity. And you need people from these kinds of communities as well for moral reasons and for those practical reasons. A lot of people here are essential workers. A lot of people here work in healthcare. So again, there are a lot of reasons to bring everybody involved in this process. It's proven to be a struggle so far. Week, 8, 9 or so into this whole vaccination effort. But the bottom line is, the hope is that there'll be more supply, more generosity, and more doing the right thing as well. Allison?
Yeah, Ron, tough to get to that herd immunity when there just aren't enough shots to go around. Just one of the issues so many cities and states are dealing with. Ron Allen in the Bronx, thank you.
Cases are now back to the level we were before Thanksgiving. Similarly, new hospital admissions have continued to decline since they peaked on January 5th. Decreasing 4.1% to an average of approximately 11,400 admissions per day from January 25th to January 31st. While deaths have continued to increase, their pace appears to be slowing, with the average number of deaths increasing 1% to slightly more than 3,100 deaths per day from January 26th to February 1st. And the recent decline in hospitalizations gives us hope that the number of deaths should start to decrease in the coming weeks.
NBC News senior medical correspondent Dr. John Torres joining me now. Dr. John, we heard Dr. Walensky there, hopeful, but help us put all of those numbers into context. How would you describe where we are in this pandemic right now?
And Allison, I think the best way to describe it is, yes, a lot of experts are hopeful, but we're not out of the woods yet. And we talk about these decline in numbers. We talk about the decline in hospitalizations, but the death rates are still rising, although not as quickly as they were. And we knew that would happen because we knew that death rates followed hospitalizations, which followed cases, and that usually goes in 2-week increments. So, once cases start to come down, it takes 6 weeks for those death rates to start to follow and come down as well. And I think that's kind of what we're seeing right now. But overall, looking at the picture, and you can see on your graph right there, we had times here where our cases were down in the 20,000 range. Our death rates were down, 500-600 deaths a day across the country. And so even though these numbers are coming down, they're still a lot higher than they've been at some points throughout the pandemic. And we need to get back to that stage again. And that's when we can start saying we're making a good headway against this pandemic. We're really doing what we need to do. At this point, we all need to double down and do those things that we need to do. Vaccinations need to work, like Ron Allen was talking about. We need to get those out a lot quicker and to a lot more people to get all this under control, Allison.
An interesting point Dr. Walensky made today. She said the data does not suggest that we need to vaccinate teachers to keep schools open. Dr. John, I know this is a huge issue, especially in some big public school districts like Chicago. The teachers do not want to go back to the classroom without getting shots first. Can you explain what Dr. Walensky is saying here, what that data shows here?
Right. And what she's saying is basically, they're looking at the data from a perspective of, who are the most vulnerable, who are most likely to catch and spread coronavirus. And if you actually look at the data, schools happen to be one of the safer environments we have there. And so schools opening up right now are very safe environments for the most part, assuming they do those things they need to do. But one of the steps they need to do is make sure their community is safe. And so getting vaccination rates up in the community overall is the important step. As far as vaccinating teachers, yes, they do need to be vaccinated, but them opening without being vaccinated can be done in a very safe manner, and then get the vaccinations as time goes on, because like we've talked about constantly for the last couple of weeks, we're just not rolling out those vaccines as quick enough. So unfortunately, we can't vaccinate everybody at once. And so we have to pick the ones that are more vulnerable, ones that are more likely to catch and spread it. And teachers are not in that group right now. I know it's going to be controversial, but that's what the data shows.
Dr. John, New Jersey is increasing its indoor dining capacity to 35%. New York City reopening indoor dining on Valentine's Day. But the CDC recently said schools can reopen safely only if other things stay closed, things like indoor dining. So is this going to be a problem for our schools? What do you think about this one?
Allison, it is going to be a problem. And when you look at the data and you look at one of the steps they talk about taking to make sure schools are safe, besides, kids and teachers and staff wearing masks, social distancing, washing hands, not coming to school if you're sick, and lots of testing, all those things. One of the big things they talk about is keeping community spread under control. And that means keeping those things closed where it could possibly spread. And what a lot of experts say, which I agree with, is it doesn't make any sense to open up everything but not open schools. Schools should be the first to open and the last to close. These other venues, restaurants, bars, and I know we want to go back to those, but they need to look at closing those to keep the schools safe. And then once the community gets under control, then slowly opening up those as well, Allison.
Dr. John, I know it is encouraging that coronavirus cases, hospitalizations, deaths are all heading in the right direction. But Dr. Fauci is warning about another upcoming super spreader event. Take a listen.
Enjoy the game, watch it on television, but do it with the immediate members of your family, the people in your household. As much fun as it is to get together on a big Super Bowl party, now is not the time to do that. Watch the game and enjoy it, but do it with your family or with people that are in your household.
Dr. John, we're just coming out of our holiday surge. New variants are spreading across the country. What's your advice for football fans out there?
And Allison, if you look at the pandemic over the last year, what you notice are these rising cases, these surging cases after these people start gathering at these events, Memorial Day, Labor Day, 4th of July, Thanksgiving, December holidays. It followed a pattern of 2 weeks later to 6 weeks later, having these rising cases, hospitalizations, and deaths. And the concern is with people getting together for the Super Bowl, which is a very traditional thing here, that could repeat. That pattern could happen again. And so obviously the big advice is not to get together with anybody physically. Do it all virtually. And if you do get together with people, which we know some people are going to do that, at the same time, the CDC saying there are ways you can minimize the risk. There aren't ways you can make it safe, but there are ways you can minimize the risk. And that includes, limiting the number of people that are there, show up early, leave early, so you minimize the time you're there. And then they talk about a couple things, especially if you're at a venue. Avoid going to the bathroom or going to concessions at halftime, because everybody's going to be doing that. You want to make sure you're not sitting in a crowd. Avoid cheering, which is hard to do. Avoid shouting. They're saying instead clap, stomp your feet, bring a noisemaker, which sounds odd, but they're trying to make sure that you're not spreading the virus by talking very loudly or singing or shouting. And then again, wear a mask. I can't emphasize that. The whole time you're there, wear a mask. Obviously, again, the best thing to do is not go, do it virtually. But if you do go, take these steps to minimize your risk.
Dr. John, I would never survive at a stadium during a pandemic. I am both loud. You can't get me to sit down. I would have to go to the concession. I would need to go to the bathroom. I should not be allowed into any of these stadiums till I'm fully vaccinated. We're just going to do the beer and the nachos and all that at home. Much better idea for us.
And I agree with you. Same thing. It's hard not to do those things, so just stay home and celebrate that way. Watch the game.
Yeah, you can scream all you want from the couch. Dr. John, thank you so much.
You bet.
Missouri is switching up its COVID vaccine distribution strategy, giving select hospitals the majority of its doses. Those hospitals able to vaccinate 5,000 people a week. NBC News Now correspondent Dasha Burns joining me from St. Louis. Dasha, Missouri is one of the worst 3 states for vaccinations per capita. Just 7% of its population has gotten a shot, according to the Department of Health. What has it been doing wrong?
Hey, Allison. Well, it's a complicated story here, as it is in so many of the places that we've been covering. First, while that data and those rankings are important indicators of the challenges states are facing, they also don't necessarily paint the full picture, right? So you've got these data system problems, which are plaguing states across the country, by the way, where you're not necessarily getting those real-time updates because these systems they're old technology, they're slow, and sometimes they lag about 2 weeks behind. So that's problem number one. You also have this confusing guidance and debate around first doses versus second doses. So there's been some debate about whether states should just be giving out all those first doses as much as possible and hoping and crossing their fingers that enough will be produced for second doses. Here in Missouri, they are very diligent about reserving those second doses. So that might be part of the data and the numbers that you're seeing reflected. But there certainly are challenges. Missouri ranks among the lowest when it comes to states spending on public health. So a lot of the public health departments in the state weren't necessarily resourced enough for a huge lift like this. You also have had a very decentralized approach in this state to vaccine rollout, which meant that especially earlier on, everyone was sort of on their own and applying for as much vaccine as they could get. And you wound up with situations where some places had a little bit more, some places not enough, and they had to sort of work to create a redistribution network. What this new approach does is it looks to centralize and streamline this process by prioritizing places like the hospital behind me, the SSM St. Louis University Hospital, which can vaccinate 5,000 people a week, could probably do even more than that. So the calculation here is, in the short term, to get as many arms into folks as quickly as possible. And I'm sorry, we've got a big old truck traffic jam here, so you're hearing some noise behind me. But the calculation is prioritize these large-scale vaccinations, get as many arms in people as possible, and that will help streamline this process. The health experts I've been talking to say the biggest change here really is going to be consistency. And that's been so critical because right now, week to week, they don't know how much they're going to get. This hospital hasn't received a shipment in 2.5 weeks. So that's really the big change here. The one thing that's not going to be different, though, Allison, is the supply issue. I want you to hear from the head of the St. Louis Metropolitan Pandemic Task Force on the tough spot the hospitals are in when supply is not keeping up with demand. Listen.
We have to look at who is most at risk and make sure that we're taking care of them first, because they're the ones that are at risk of getting really sick and potentially dying, and also putting a burden on the healthcare system to take care of it. And so it becomes, again, a really tricky method of how do you allocate a very scarce resource for the population.
Dr. Garza also says that Missouri is receiving less allocation than some other states per capita. So in order to increase their vaccinations per capita, they really need more supply, as so many places do, Allison.
All right, Dasha Burns in St. Louis, where apparently they just had a Honk If You Love News Now campaign going. I'm here for it. It was great. Thanks, my friend.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.